1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer. But despite those huge numbers, most individuals don't know what that really means. At the simplest level, cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredible phenomenal control, and if something goes wrong and that control is lost and particular cells escape the normal control mechanisms, they can continue to grow and may spread, as we call cancer. Those cells together we could call that a tumor. Specifically, cancer is malignant tumor, and we call it malignant because not only can it invade into adjacent organ. Unfortunately, cancer can spread to other tissues and can be life-threatening. Cancer can actually occur in anywhere in our body because of cells in our body. In women, one of the most common cancer is breast cancer, and men, prostate cancer, and in both men and women, lung cancer and colon cancer are common. It's important to understand that the cancer that occurs in one individual is very different than the cancer that occurs in another, just like those individuals are different. So a lung tumor in one person will be very different from a lung tumor in another person. Once the diagnosis of cancer is made, of course, the next obvious question is what to do. There are several things that really relevant to the stage of the cancer, where is the cancer, you say it's particular kind of cancer, it had spread to other organs of the body. Cancer treatment actually is very complex, and part of the reason is because cancer is these constellations of over 200 different diseases. They have common characteristics that are very different from each other. In addition to that, the cancer itself is not homogeneous. There may be 3 or 4 or 5 or 6 different slight variations in cancer cells that are there. People ask why does my cancer doesn't go away? It's shrunk by 70%. What's wrong with the other 70%? Quite different treatment. There are 3 primary therapies for cancer: surgery, radiation, chemotherapy. Surgery works by directly removing the tumor. Radiation therapy provides X-rays to kill individual cells, and the chemotherapy provides chemicals that can kill those individual cells, but they have side effects. The best therapies that you can produce really are the result of optimizing the amount of tumor that we can kill by any treatment and minimizing the amount of normal cells that would be affected by the treatment. At Cancer Treatments Cancer America, we have a very robust integrated oncology program. Integrated oncology is taking those conventional oncology treatment and with therapies like acupuncture, naturopathic medicine, chiropractic, nutrition, those plans together, and to create the both appropriate treatment plan for individuals at that moment at the time. Cancer Treatment Centers America has invested in a model which all of the fake cancer that aggressively treated and managed is not just enough to kill cancer if we don't treat the pain, the fatigue, the depression, of the anxiety that comes with the diagnosis of cancer. Receiving a diagnosis of cancer can be a frightening thing. The good news is that today is probably the most exciting time in history in terms of the treatment of cancer. Option that didn't exist a few months ago certainly didn't exist a few years ago, like the ability to genomically profile a tumor and to take that individualized fingerprint of that cancer may direct us to tailor treatment in very specific ways. We believe that in the future, many more patients with a number of different tumors will be able to benefit from the advances in precision medicine. There are very hopeful options that are available to us as clinicians to make a difference in patient lives. And it's therefore just as important for the patients to know that they have hopeful options. They will take advantage of them.